The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
Good morning, everyone. My name is Dr. Charlotte Ortiz, and today we are going to continue our lecture in the states of consciousness. If you recall from your previous lectures, you will remember that one of the things that we covered was being fully awake, right? For example, ordinary wakefulness. We also covered the different stages of sleep, right? So for example, we did talk also about our circadian rhythm, and we talked about the stages of sleep and REM sleep. So are there any questions regarding those processes and those different states? So today we're going to cover something that a lot of people are interested in and that a lot of people are drawn to when it comes to the field of psychology, and that is the world of dreams. So let's get started. Now, one of the things that you may be aware of because of your own experience is that generally the content of dreams, right? We focus a lot about the content of dreams. Now, notice that a lot of your content, right? A lot of your content is going to be affected by that external stimuli. So for instance, sometimes you feel like you're swimming, or you feel like you're in the ocean, you feel like you're under a waterfall. It might just simply be that you need to go to the bathroom, right? It could be simply something as mundane, right? As just wanting to go to the bathroom, right? So notice that because of that, most dreams are relatively mundane, right? A lot of people place a lot of influence, right? When it comes to the meaning of dreams, right? But keep in mind that most dreams are mundane, right? Most dreams don't necessarily have another layer, if you will, to their purpose or meaning. Interestingly, another thing that can impact, right, the content of your dreams is basically what is presently, right? What is going on in your life? In the field, in practice, we call that presenting issue. Right? That's a little fun fact for you guys who are interested in the field. Presenting issue is basically what brings you to therapy, right? What is the main situation, right, that it's bringing you to therapy? So a lot of your dreams, right, are going to be impacted simply by the situations that you're currently experiencing, right? So for example, if you're stressed out over a course, right? If you are worried about your relationship with your parents, your relationship with your significant other, right? So things of that nature, worried about money, worried about your children. So notice that your dreams can also be affected not only by just general stimuli. So for example, if your room is hot, if your room is cold, you have to go to the bathroom, right? They can also be affected by the things that are occurring in your life. Now, common themes of your dreams can include familiar settings. Right. So generally, when you're having a dream, you can find yourself having a dream of places and situations where you have been before, right? So for example, you may start having a dream about being on campus, right? You may start having a dream about your hometown, right? You start having a dream about dear old Dr. Shar. In that case, it's probably a nightmare, isn't it? Having a dream, it's probably a spooky nightmare that just show up, finish the test, right? So it might be a nightmare, right? But it's generally based on familiar settings, familiar people, colleagues, coworkers, things of that nature. Now, whenever we start having dreams, generally, the average dream and the average person, right, is able to tolerate right? Those illogical situations, right? Most people are able to tolerate illogical situations. So for example, if you are dreaming, right? A lot of people that have PTSD, a common theme is that they're dying. Either they are being killed or dying, or they are killing someone themselves, right? So, and when I say PTSD, right, post-traumatic stress disorder, a lot of people think about PTSD. So I'm going to make a little caveat under here. A lot of people think about PTSD and think about war exposure, right? Conflict, right? Iraq, Afghanistan, Gulf War, things of that nature. But PTSD can result from any traumatic experience in which your life or the perceived life of another person was in severe risk, right? A lot of people forget that. So for example, kidnapping, right? Kidnapping would be one, a car accident, right? Surviving a natural disaster could lead to PTSD, right? Because those are instances in which this situation led to a very plausible risk of losing your life, right? Or witnessing the loss of another person. There is an exception to that if your job is related to that, right? So for example, if you're a police officer, right, and you are witnessing a lot of situation and it's part of your job, right? It's part of your job that you are exposed to situations that require severe injury or risk of losing your life. Paramedics, right, first responders, people who work as first responders, right? So generally, most of us can tolerate the dreams that are illogical, right? For example, me wanting to kill someone, right? So that would be an illogical thought because I don't have that desire, right? But some people cannot tolerate the illogical discrepancies of dreams. And we will cover that a little bit more in detail later on. And as you know, one of the cinematic expressions of PTSD is nightmares. It's pretty common. I did want to throw that in there for sure. Now, generally, most people dream in the first person perspective. Most of the time, most people will dream in the first person, right? You're witnessing the dream like it's a movie, right? Some people do dream in the third person, and there is some evidence to support as to why some people dream in the third person. We will cover that a little bit more in detail later on. So any questions about the general concept of the content of dreams? Any questions? All right, good deal. What about for, yes, sir?
You know if it's true that basically seeing faces of people can be sometimes weird, like only seeing faces of people you've seen, or in my case, sometimes I don't see faces, or at least not physically, only have an idea of it.
So you mean that you can't recognize the face?
Yeah, like is there something that is noted to be different about people dreaming faces?
So one of the things, so the question was, if I have difficulty recognizing the faces in dreams.
Well, I know what the face is, but like I kind of get it's kind of weird. It's like I have knowledge of it, but it's hard to actually picture it.
Okay, so something really important about the interpretation of dreams is in a practice perspective, right? So different schools of thought in psychology. So you have psychoanalytic, we've covered that before, neuropsychology, we've covered that before, cognitive psychology. Depending on the school of thought, they will have a different, let's say, assessment or interpretation of your dream. Now, we can go the Freudian route, we can go the cognitive route, but one of the things that I like to do is put it on the client's table and have the person interpret their own dream. Because ultimately, my interpretation may not necessarily matter to the individual. It's more about what the person considers that interpretation to be. So I'm not going to have you interpret your dream in class, right? Because that would be too real. Maybe something's going to come out, right? That you don't want to, right? So, but keep in mind that generally my approach to that is having the client interpret the dreams themselves.
Well, that's not interpretation. Or like I've heard that basically, you in dreams you only see people that you've seen in real life. Like
And
you
that
can't
is true.
imagine a new person. Yeah, that's true.
That is correct. So we have an ability to create our own faces, right? So generally the faces that we see in dreams come from a face you have seen before. We do have an ability to do that. So that is correct. Right. So let's go back to our slides. Now, when it comes to dreams, generally in Western cultures, we generally may consider, okay, well, my dream was insignificant. It was simply a dream, right? So we may start thinking that our dream was insignificant, right? But in other non-Western cultures, what do I mean? Well, when I refer to Western, I want you to think about, say, for example, Europe. I want you to think about the United States, right? And then for non-Western, I want you to start thinking more about what I like to call the other side of the world, right? Now, for some cultures, it is immensely important, right? It is important to understand the sources of information. They think that a lot of their dreams have a significant foundation about understanding the self, the future, or the spiritual world. Why does that matter? Well, notice, right, that you as a practitioner, right, when people say, oh, when I become a psychologist or when I become a therapist, become a counselor, things of that nature, I don't have any bias. I can talk to everybody. Okay. How comfortable would you be to counsel a person who's been convicted of child rape? If that bothers you, that tells me you have a bias, right? Because our intent is to serve individuals, right, with less bias in order to provide the well-being of the person. So you culturally already have a bias, right? You may think that dreams are important. You may think that dreams are not important, but you will find a client that is going to say, this dream is super important. I think my ancestors are trying to talk to me, or I think God is trying to talk to me through my dreams, right? And irrespective of your perspective, right, it's where the client is. You as a therapist have to put yourself in the client's position. You need to see what the client sees, not what you see, right? So that's why we talk a lot about culture in mental health, because ultimately we try to see things how the client or the patient sees them. Some of the more common dreams, right? Some of the common dreams include falling, right? Falling, I'm being followed, right? Or having sex, right? Those are pretty typical dreams. They appear to be universal, right? So regardless, right? Regardless of the culture, these seem to be very common and very well-known dreams across culture. Now, some of the more specific content, however, may vary specifically from one culture to the next. I would argue that the interpretation of the dream varies between one culture and the next, right? And I'll give you an example. Not necessarily dreams, but let's talk about hallucinations, right? So here in America, when a person is schizophrenic, and it's a paranoid schizophrenic, whenever they try to interpret their hallucinations, they will generally say, this person is trying to tell me to harm someone, or this voice is telling me to harm myself. This voice is telling me that I am useless, that I am stupid, right? But sometimes schizophrenia in other cultures, right? And we talked about biological foundations of behavior. We talk about sensation and perception. In other cultures, schizophrenia looks like they're just wanting me, that voice is just wanting me to communicate with other people. That voice is telling me I'm pretty good, I'm pretty fly, right? Kids say fly anymore? I don't know, lit, drip, I don't know, something like that. You get it, right? You guys get it. So notice that the interpretation, even though in this case it's a symptom of schizophrenia, but with dreams it's the same thing, right? The content is going to change based on different cultures. So any questions here or any questions from my students joining me online?
Why do we dream? Like, is there any theories on that?
That is a great question. Why do we dream? The answer to that is we don't know. Look at that. The answer to that is we don't know. We don't know exactly why we dream. There are,
There's no theories or anything? No, like,
we do have some hypotheses for sure. We do. We actually don't know exactly why we dream. And interestingly, that's our next slide. Look at that. It's almost like he was making sure that I was on check, you know? It's like, I got you, not the show.
It's a good segue.
Right? Right. Especially for YouTube. Why do we dream? We don't know. We don't know exactly why. Now, remember that I mentioned that we can use different schools of thought in order to provide an understanding and interpretation of dreams. So let's talk about the psychoanalytical perspective. By the way, this is the symbol for psi. So for those of you who are later going to move on to practice, that's the symbol for psi. Let's talk about the psychoanalytic perspective. One of the reasons, according to Sigmund Freud and the perspective of dreams, is that generally we are trying to fulfill a purpose, right? We have this wish, we have this desire, we have this perhaps unconscious desire that it's being manifested through my dream, right? Because of that, because it is unconscious, it may not be obvious to you, right? It may not be obvious to you. And that's when a lot of the popular, Reddit, Discord, things like that, that's when like, oh, this dream means something, right? That's more of the psychoanalytical approach, right? I wouldn't necessarily call it a perfect science, right? There is some merit to that proposal though, because we do have unconscious wishes and desires, right? Now, what happens is that throughout our dream, we are having, or perhaps when we are conscious, we have attempts to censor, right? We have attempts to censor our wishes, and therefore, they're going to be manifested through our dreams. Which is why a lot of people place value in the interpretation of a dream. What does this mean in the Queen's English, right? What does this mean in plain old English? You have unconscious desires that generally could be considered as taboo, uncomfortable, traumatic, anxiety producing. And according to Freud, these unconscious thoughts have to be manifested somehow. So they're going to be manifested through a dream. After they're manifested through a dream, it's your job with your therapist to find out what is the meaning of this dream. That is one of the reasons why people consider that we have dreams, because your unconscious is trying to manifest itself somehow. So one of the more common ones that Freud used to talk about quite frequently was women thinking about, dreaming about being on an open field, or on the beach, riding a horse, right? Common dream, right? So Freud attributed it to women wanting to have sex and be penetrated during intercourse, right? So that was his equation. So it's taboo to think about that on a conscious level, but Freud would say, she just wants to have sex. That was one of his interpretations for the dream. So in regards to the psychoanalytic perspective and dreams, any questions about that for my people here in person or my people here online? All right. What's another reason? What's another reason why we dream? Well, our first reason was we're trying to view, right, that unconscious. Simply, my brain is trying to make sense of that unconscious. Now, the second reason that we have hypothesized that we dream, dreams give us the opportunity to rehearse, to work through your everyday problems. So, think about I'm having a dream about, let's say, something stressful generally. Let's say you have to take a test, or you're going up for a job interview. It's an everyday problem. So notice that you start dreaming about this big job interview, right? Or you start dreaming about your test. The hypothesis is you are dreaming about this almost as a rehearsal. So for those of you who are in theater and the arts or appreciate theater, we rehearse as a form of practice, right? So the proposal is we have dreams as a form of practice, right? I know what the problem looks like. Let me rehearse it over and over again in my dream so that I can find a solution. So that's another reason. Now, I like to think about, some of the more irrational ones. For example, I'm dreaming that I'm being, have to fight a lion. Chances of me fighting a lion downtown, in my little suburb home, they're pretty slim, aren't they? But the brain considers that I need to rehearse that, right? Because of an everyday problem, well, I don't know what are the chances of me fighting a big old lion in the suburbs, right? So notice that one of the other reasons that we think we dream is to attempt to rehearse and find solutions to our problems. The good thing about this perspective is that it allows you for that reflection, right? It allows you for that reflection of that emotional experience, right? How am I going to work through this emotional experience, right? You start dreaming about this interview, for example. Because of that, generally, we do find improvements. We do find improvements when the person wakes up. Because now I have practiced it, right? For those of you who are in sports too, you do a lot of training and practice. I know what it feels like. I know how to be ready for the big game. And that's the proposal as per Cartwright. Right? The proposal was we dream so that we can practice, so we know what it feels like when we were just faced with it or about to be faced with it. So any questions about that? Good deal. Good deal. Another reason, right? Another reason that we consider that we have dreams, it's simply because during the time that you are having dreams, if you remember from our previous lecture, and I'm just going to pull that up very quickly. If you remember from your previous lecture, remember that the activity during REM is super active, right? It's super fast. It's very similar to when you are awake, right? When you are awake. So another reason why we think we dream, it's because we are trying to make sense of all of these flashy images that are coming about because your brain is immensely active during REM sleep. So that's the third reason why we think that we are dreaming, because your brain is immensely active during that time, and your brain is simply putting all these images together, almost like editing a video, right? Look at all these images that are flashing. Therefore, your brain, as a logical creature of its own, tries to make logical sense of these images, and then you start having dreams, right? Sometimes they don't make sense, a logical sense, but your brain is trying immensely, right? It's trying to conduct a synthesis of this activation, right? Of your brain being so active during your sleep.
So the brain is essentially just throwing up like Rorschach tests, and your mind is trying to decipher.
Yeah, pretty much. So Dr. Tyler, got it right. Look at that. I never know anybody's name. So if I know your name, is that a good thing? I don't know. Could be a great thing, could be a bad thing. Aha. But either way. So what happens, what Dr. Tyler mentioned, right, is that it's almost like a Rorschach, right? So I'm just throwing ambiguous images at you, make sense of them, right? Now what happens is because during your state of dream, your neurons are firing, right? Periodically, and they are sending signals to your cortex. what your cortex is simply trying to do is make sense out of all this firing, out of all these signals that are coming in. However, with this specific model, with this specific theory, the issue is that we're minimizing the dream experience, right? We are downplaying the emotional factors, right? So if you notice in our previous examples, right? So with the first reason why we dream, right? We have unconscious desires, basically anything that keeps us alive. So water, food, shelter, sex, right? So the first idea was we dream because we have these unconscious desires that need to be manifested. Our second idea with Cartwright was you're just trying to figure out how to solve a problem. You're rehearsing, right? Like it's theater, like it's sport, right? We're practicing. And our third idea, where there's no such thing really, is because your brain is so active, it's just putting all these little images together. Hey, here's a dream, right? But the problem with this last theory is that it takes away from the emotional components, right? The emotional components of the dream. I'd argue that at the very least, it takes away from the fact that people do get emotional. They have emotions towards their dreams, right? So they're angry, they're happy, they're scared. So I would argue at least it takes away from that emotional component, because most people would say, I didn't like this dream, I'm scared, I'm worried, I'm happy. So at the very least, I'd argue, yes, it does take away at least that component. And interestingly, when you become a therapist, you may find yourself in that situation when you downplay the emotional factors of your clients. Right? That's something that in practice I've had to work with. Right? I am an immensely rational person, too analytical perhaps, which is why I did that for a living for 10 years. Right? I was an intelligence analyst for a long time. So when you're faced with a client that's therefore an emotional issue, and you're more of a rational, scientific person, then, or left brain, if you will, we talked about that previously. Notice that you may start downplaying the emotional factors of your clients, or vice versa. You're focusing way too much on the emotional factor of the client. So, any questions? Yes, ma'am.
I actually have two questions. One is that I've heard that dreams are like relatively short. Why do they feel so long?
So generally, dreams can be short-lived, but I'd argue that sometimes if it's a recurring theme, they may be chronic in the sense that you're kind of having the same dream over and over again. So are they really short? Does that make sense? Because if tonight I have a dream of being kidnapped, right? And then 2 nights from now, I have the same dream. And the next week I have it twice or 3 times a week. Was it really short? Or is it more long-term? Is it more chronic? Right? And is it causing me distress?
Talking about like when you're sleeping all night.
So remember, right, if we go back to our previous lecture, let me see if I can pull it up. There we go. Let's share the screen for those of you watching at home. So remember that you dream during your REM sleep, right? Whenever you're engaged in a REM. It does get periodically longer. So for example, maybe you're only dreaming for 10 minutes, then you're going to be dreaming for 20 to 40, 20 to 60. So it does get progressively longer as the night progresses.
And my second question is, why do you forget dreams so easily?
I'm sorry?
Why do you forget dreams so easily after you wake up?
Why do people get dreams so easily or what?
Why do we forget dreams so easily?
That's a good question. Well, first of all, the question was for those of you watching at home is, why do we forget dreams? Generally, we can go back to the synthesis, right? We can go back to the activation synthesis theory, which says there's actually no true foundation, right? They're maybe meaningless, right? So it's a cultural aspect for one thing. Some cultures deem dreams as unimportant, right? So it's more important about being in the conscious than being in the state of dream. There could be an explanation through the activation synthesis model. So we can say it was simply firing of images. There was nothing really deeper than that. So your brain may want to save that hard drive for things that you do need to learn. For example, that one equation for your engineering class. So basically it's hard to save up that space. And by the way, that's another reason. Your book doesn't mention that, but that is also another reason why people think we dream. is we're trying to consolidate all of the memories that we've had in recent past, right? So another reason why we think we dream is your brain needs to basically put together everything basically on a zip file. Let me get rid of the files that are not important. Let me just save the ones that are important. So that's another reason, because it might do away with factors that perhaps it didn't deem as important, right? Does that answer your question? Yes, sir.
So kind of going on her question, so does that mean that other cultures that do put more emphasis and more importance on dreams, do they tend to remember their dreams better?
It depends on the importance that you place to them. Generally, you have to start writing them down within 5 minutes of waking up, because now your brain has other things to worry about, like i.e. my survival, right? So if we were to think about our ancestors, for example, imagine, one of our ancestors were, I wonder what this dream meant. No, mammoth, right? So we wouldn't say necessarily in that dream, but that depends on the importance of the culture. So some people would actually do take the time and say, okay, what did this dream mean to me? How am I feeling right now? So it would depend on the importance of the place on that for sure. So right now, if I tell you guys, hey, write a little journal about, for yourself, about your dreams, now you're placing more importance, therefore you're going to remember your dreams a little better. Whereas
That sounds like it's less cultural though, and more just like if it's sorry.
you're fine.
Like for example, I've heard that people have like their first memories also correlates with like how that culture puts an emphasis on individuals.
Right.
So it doesn't sound like, from what I'm getting at least, it doesn't sound like it's so much the cultural importance of dreams, but how much you pay attention.
Well, and remember, how much you pay attention depends on your culture, which is the point that I'm trying to make. So for example, if, let me use another example. Let's say if I place importance upon the negative symptoms of schizophrenia, and negative symptoms are like withdrawal or not being socially there. If your culture places more importance to that symptom, means that maybe those symptoms are going to be manifested stronger, right? So sure, you're paying more attention to those symptoms, but that was culturally based because your culture did tell you that that's what you need to focus on. We may not have a conscious effort either, because socially we've been told since before we're born how to behave socially, right? So for example, it's a boy and he's going to wear blue, and like before you're even out of the womb, we already have social norms that are put into you. And because of that, you're going to behave a certain way, right? So for example, my experience as a middle-class biracial woman, millennial, I'm going to behave differently than say a Black woman, right? So my behavior will depend inherently on my culture. Right? It would at least inform my behavior. Do I have to remain with that? Absolutely not, right? You can choose to deviate from your culture. But paying attention, for example, to symptoms, what symptoms we categorize as important, what dreams we categorize as important, that is where that culture may or may not place that. Does that make sense? But that's also a good point, because when we are talking about culture, as you can see, culture even affects the interpretation of your symptoms, right? All right, let's talk about hypnosis. What? Let's talk about hypnosis. That's always a fun topic, right? Now, what is hypnosis? Hypnosis is a suggestive procedure, right? It's a systematic procedure in which we are trying to produce a heightened state of you being suggestive. That's what hypnosis is, right? I am trying to increase that state, that likelihood in which you're going to be more persuaded. Let's use that term. How about that? Now, interestingly, different people will respond differently when it comes to being hypnotized. What does that mean in plain old English? It means that if you are a hypnotist, there is a certification, I believe, for hypnosis in our state. I'm not sure, don't quote me on it, but I think there is. What I'm trying to do as a hypnotist is to put you in a state of mind where you can be influenced. Which is one of the reasons why testimonies offered while in hypnosis are generally not admissible in court. Because during that time, we're highly suggestive. Certain people, right, are more prone to being hypnotized than others. Now, some of the hypnotic phenomena, right, it can occur while under anesthesia, right? And we're going back to those states of consciousness, right? Remember, we had ordinary wakefulness, that we had slightly kind of, but not really, I'm awake, not really, right? That's when your friend nudges you, hey, you're not watching the movie, you're like, I was totally awake. Right, so during that time, it's easier to hypnotize an individual. Unfortunately, some of the things that we may encounter, right, during hypnosis is sensory distortion, right? So you start feeling things, you start seeing things that may or may not be there, right? So for example, if the person's being hypnotized, right? The person's being hypnotized, then they might start feeling really cold when, you know, we're at room temperature 75 degrees, right? Or they start seeing things. Another characteristic of hypnosis is disinhibition. People who are hypnotized tend to be more prone into doing things they generally would not do, right? So for example, when I teach class, you know, I try to move around a lot so I keep you guys awake, right? You're not just looking at the slide for, you know, an hour and a half. But notice that normally I conduct myself a certain way in the classroom. But imagine if I'm hypnotized, I may be suggested into being more, let's say, less sober, right? So for example, I'm suggested into banging my chest like a orangutan, and I start barking and get on all fours and start, you know, running around the classroom. Because during that state of hypnosis, I may do things that I would normally not do, right? Which would be, you know, running around here like I'm a dog, right? Now, one of the issues with hypnosis is that we can have post-hypnotic suggestions, right? We may start considering that the things that we said, right, or the things that we recalled during, right, during that time stand true. And we start remembering them as things that stand true. And what do I mean by that? Say, for example, you're being hypnotized because we're trying to develop a sketch art of a suspect, right? And you really don't remember, so we're going to send you to a hypnotist so that this person can draw more information. Quite literally, huh? No pun intended, draw, yeah, it's a suspect. Moving on, I promise you, I'm a doctor, I promise I went to school. So, notice that when the person, quote, wakes up, end quote, from the hypnosis, now they're going to think, that is exactly what this guy looked like. Now they're going to have this post-hypnotic suggestion, when in reality, maybe that was not the case. Maybe that's not how the person looked like. But for instance, the sketch artist or the hypnotist says something like, well, when they're talking to you, they'll say something like, well, he had really wide eyes, or he had really small eyes, or he had a really strong jawline. You didn't say that. The hypnotist said that. The sketch artist said that. So now you have been suggested into thinking, and you will truly believe it, that no, he had a really strong jawline. When in reality, you might have not even said that in the first place, right? When you were being hypnotized. So any questions about hypnosis? All right. Now, interestingly, some people are more prone to be hypnotized than others, right? One of the things is if you are already prone to hypnosis, right? So imagine that I brought a hypnotist here in class, right? I mean, I would have done it. I'd be like, I volunteered, right? I volunteered as tribute, right? I would have been the first one. It's like, yeah, I want to be hypnotized. I've never done that. That's pretty cool. I did a lot of research when I was in college. Like I volunteered for everything, There's a show that I volunteer for every single experiment they have, right? So if you're already prone into, yeah, let's do it, you are likely going to be more easily hypnotized to say someone like, all right, let's do it. I'm not feeling it, right? I don't really want to get hypnotized the rest of it. By the same token, these same people are more prone to be disinhibited, right? So for example, when this person that was all for it, they get hypnotized, they may be the ones that are, walking in on floors and banging their chairs, right? Doing really silly things. What are the issues when it comes to hypnosis, right? What are the issues? The thing about hypnosis is sometimes we do have role playing, right? We want the person to act out, right? Either their experience or certain commands. Now, some people may be prone to just show what they think a hypnotized person looks like. So basically, you're acting how you think a hypnotized person is supposed to act. So notice that it may not be genuine. It could be malicious, or it could be without the person's awareness. But you're going to start behaving in the way you think, oh, this is what hypnotized people look like. Therefore, let me behave how hypnotized people look like. All right? It could be maliciously, you're doing it on purpose, or simply you truly act out like how you think hypnotized people act. The evidence suggests that when it comes to hypnosis, generally the effects tend to be exaggerated, right? So when these types of research come into scrutiny, remember we have peer review and things of that nature. We know that generally these actions, this role play, we do come across the fact that yes, it could have been exaggerated. Interestingly, another reason why role playing through hypnosis can be a problem is because situational factors can also make you more or less suggestive in terms of acting out your role, right? So think about if you hypnotize and I give you a command of like start acting and crawling on floors and start barking. If you're in a classroom full of students, you may feel okay to do that. Imagine if you are in the audience of your parents and grandparents and me, papa, and everybody's there, you're like, I don't want to look like an idiot in front of the family, right? Or like, oh, let me look like an idiot in front of a bunch of police officers, right? So notice that the situation that you are in can also make you more prone into acting out or having certain roles, role playing, right? While being hypnotized. Now we're talking about role playing. Let's talk a little bit more about the consciousness when it comes to hypnosis. So if I clear out my screen over here, and if I grab your attention towards the right of your screen, you'll see that we may become disassociated. And I know some of you might have heard that term before. What disassociation is, very simply put, it's basically dividing, splitting, right, mental processes into separate states or streams of awareness. What does that mean? What it means is that there's almost, I like to call it like a divorce, if you will. You start divorcing yourself, right? So if you're Peter, right? Peter acts and behaves a certain way. Peter thinks a certain way, right? But when Peter is disassociated, he's going to divorce himself and distance himself from the idea of the self that he has. And now he's going to have a second state of awareness. I don't mean what people and laypersons refer to multiple personalities. That is not what this is. It's simply another state of awareness. That can happen, for example, if you are in a very serious, very stress-producing situation, And I think I brought that up in class, if not here in another course. So back in 09, I was an unfortunate victim of an armed robbery. And during that time, I disassociated, which is I had the idea of me, right? I was like 18 or something. I don't know, I was kind of young. And what happened was that I had this idea of me that is aware of what's going on, right? I'm in my car, there's two gentlemen, right? And there's that idea of me, but then there's another idea that says, this is a movie, right? This is not really happening, right? I must be dreaming, right? So I wasn't scared because generally when we provide a disassociation, right? We're trying to divorce ourselves from that situation with the intent of not harming ourselves even further, right? Of not engaging in any harm any further, right? I probably didn't start getting scared probably like another like 30 minutes after it had happened, right? When my boyfriend at the time hopped in the car, it's like, hey, and I'm like, right? I was still in that disassociative state because of fear, right? So with hypnosis, the same things occur. The same thing occurs, right? So we are divorcing ourselves from two states of awareness. The Peter that is not hypnotized and the Peter who is hypnotized and is being put in a second state of wakeful or awareness, if you will. So if we go back to our slides, you'll notice that how one version, right? One version is going to communicate with the hypnotist, right? That external world. And then that other version, right? It's basically that hidden observer, right? Unlike role playing, we do have some evidence to suggest that we do engage in a divided consciousness whenever we are hypnotized, right? It's almost like there's two versions of Peter, right? The Peter who is aware and hanging out with the hypnotist and listening to him, aware of his external stimuli. And then we have another Peter who is like in this state of, well, it's this wakefulness, I'm highly suggestible, right? Just similar to that case in that armed robbery, there was the Char, right, back then, that Char, nothing can happen to her, right? She's safe, right? She's in her car. Whereas it was the other Char who is in an interaction with the exterior world, which is, wow, I'm being robbed at gunpoint. This is really dangerous. It's the middle of the night. I'm super scared, right? So notice how there is two, not personalities, basically two states of awareness. And people tend to confuse dissociation with multiple. It used to be called multiple personality disorder, but now it is formally known as dissociative personality disorder. So any questions about hypnosis in general?
So if you put someone under hypnosis, like under an MRI or CT scan, you can see a difference in brain function?
Yes, their responses to stimuli are going to be different. You're going to be more prone into being suggested either to do things or i.e. believe things, right? So think about when people are drunk, right? Say right now, hopefully, all of you guys are sober, right? In my class, right? All of you guys are sober, right? We don't have anybody like super hungover, is like, bro, I can't hear anything that the doctor is saying, right? So, right? So when you are sober, right? You behave a certain way. If I were to tell you, go, stand in the middle of the room and do the cha-cha dance, right? You're gonna be like, I want to do that, right? But if you're drunk, right? You're highly suggestible, right? Your frontal lobe starts shutting down. Not only am I going to dance the cha-cha, I'm gonna do a square dance and everything you want me to do because now you're intoxicated. So now you're highly suggestible, right? Because your frontal lobe decided, I don't need to do rational thinking right now because I am drunk. Right?
So with hypnosis, it is the same, like on a low,
It would-
less activity in the frontal lobe?
You will be much more suggestible, which does tell me, yes, you will have less activity, almost like. And we'll talk about that too. We will talk about drugs. Don't do drugs, kids. Don't do it. Don't do drugs. What was that thing in the 90s there? Was it there?
Yes.
Yeah. I don't know if you guys, well, somebody may
Not do
remember.
drugs.
Don't do drugs, kids. That was a whole program. That was a whole thing. How can we find these altered states of consciousness other than drugs and alcohol? Don't do drugs, kids. Don't drink. Don't do it, right? We can also engage in meditation. Meditation also does lead to an altered state of consciousness, similar to that of, well, let's not call it similar, along the lines of hypnosis, along the lines of prayer, along the lines of being intoxicated with drugs and alcohol. We can alter our state of consciousness, right, of awareness. Now, there are different aspects that we need to look into when we are thinking about meditation. First, let's talk about focused attention, right? Focused attention. When we have focused attention in meditation, I'm sure some of you either meditate in a religious sense or just in a relaxation technique sense. In this particular aspect, you're going to be concentrated in a very specific object. When I say object, I don't mean necessarily a physical object, right? But it could be. For example, we can be focused on an image. We can be focused on a sound, right? So I'm gearing my attention, right? I'm trying to provide my undivided attention to a specific object, right? The idea is to attempt, because I am so focused on the one object, right? I am focused on the one sound. I am focused on the one image. I cannot be bothered. I cannot be influenced by all of the clutter, right, of your thoughts, right? So that is the point of focused attention. I have my attention focused on the one point. Therefore, all of that clutter, all of the rest of that stimuli, if you will, can be mitigated or pushed away during focused attention. Now, another interesting aspect of meditation is open monitoring. It almost sounds like an oxymoron, right? Because if you're trying to focus on one thing, right, trying to focus on multiple things, it almost sounds like an oxymoron, but it's not. Because with open monitoring, what I am trying to do is I am becoming a detached observer. I am focusing on the here and now, the moment to moment, which is, by the way, one of the reasons why meditation helps so much with anxiety. And I'll get a little bit more in detail about that. Because I am trying to focus on the moment to moment, on the present time, I am focusing on my own sensations, right? On my thoughts, the very now and then feelings. So when I say meditation does seem to have an influence in regards to anxiety reduction, remember, anxiety is fear of the future. And when I say future, I could quite literally mean like a minute from now, right? It could be as immediate as a second from now, and it could be as immediate as like next week or next year, right? Generally, it's a little bit more immediate than that, right? That's why sometimes it leads to panic, because we have a perceived lack of control. Part of therapy is to show you how much control do you actually have over anxiety. But how do we do that? Because anxiety is that worry of the future. If you're meditating, notice that you have to focus in the right now, not the future, in the right now. How up and down your chest goes when you're breathing. Because your gut's telling you. What's the little rumbling going in your stomach? Right? Feel your muscles. Are they tensed up? Are they loose? Because I am helping you focus on the right now. Inherently, you're not worrying about the future. I'm putting you in the present. Therapy, muscle relaxation, I should say. That's another technique that we use a lot in therapy. I actually had to do that yesterday with a client because her anxiety was 1,000 reps, and I'm like, we need to take you to at least 990 because you are off the charts. So notice in her specific case, she had some sort of court proceeding going on, the custody thing today. So yesterday, we were out in the reps because we're worried about the future. So if I take you to the right now, worried about your breathing, what you're feeling, right? What you're hearing. So I'm putting you in the future. That's why meditation is so helpful. In moving you from the future and taking you into the present. Any questions about what we covered so far about meditation? Right? Yes, sir.
So with focused attention, I'm assuming if there's a problem, someone who tends to like hyper focus, especially if they hyper focus on negative aspects and that messes with their anxiety, wouldn't that make it more difficult for meditation? I guess what I'm asking is meditation like a universal?
There's a lot of cross-cultural research and for a wide variety of disorders also, and it does seem to help, right? So for example, even if, when we say hyper-focused, the first question to ask is, what are you focused on, right? So in the intent of focused attention is to focus on a specific object. And for example, your therapist would say, focus on something that is not anxiety producing, i.e. puppies. But because when someone's hyper-focused, what are they hyper-focused on? Probably, I'm going to fail, I'm not going to graduate college, I'm going to get a divorce, everything's going to be so horrible. Okay, so you're hyper-focused, but we have to redirect. And that's part of therapy too, is redirect. So instead of having this focus, I'm going to fail, never going to pass my class, or my parents hate me, never going to have a girlfriend, right? Okay, you're really focused on an object that is anxiety producing. I would feel anxiety if I was thinking like that too, right? So the intent of focused attention is to try to get rid of that clutter. Right? So we're trying to focus on the one specific image. Yeah, we could use the same area, but we're going to reframe it. We're going to redirect it during therapy, which is kind of like what was happening yesterday. That was more like psychological first aid. For those of you who don't know what psychological first aid is, it's not therapy necessarily. It's more like, what do you need right now? I need to deal with my divorce and the court proceeding. What do you need right now? We're not in court, so clearly we can't do that. So we're trying to focus and redirect that attention to the present. Does that make sense?
Yeah.
Yes. Okay.
Theory.
Now, what are some of the long-term benefits of meditations? There's many benefits to meditation. One of them, of course, it decreases symptoms of anxiety. It decreases negative emotions. And it generally enhances empathy, which is pretty interesting. Because generally when you think about meditation, you're thinking about the self, huh? You're thinking about your main man, right? Your main lady, right? Look at that. That's me. That look like me? So you're focusing on that one person. It's kind of ironic how focusing on the self leads to empathy, right? To having empathy for others and yourself. Also, it allows you to deal with your blood flow. Therefore, it can enhance and help you with your patterns of sleep. Likewise, it can assist you in improving concentration and emotional resilience. Something that it's not mentioned here, meditation can increase your immune system, right? So it's not mentioned here, and you can argue, well, you're sleeping better, you're more focused on the self, and you're eating better. So there's other arguments to support that claim. So any questions from my people here or my folks watching online? Let's talk about drugs, kids. Let's talk. I saw a bunch of heads going, right? Looking up. I see you. I saw you, right? Don't out yourself, though. Don't out yourself in my class. Don't do it. So notice that hypnosis, right? Hypnosis was one way that we can alter our state of consciousness. Meditation is the second way we can alter our state of consciousness, but so is drugs. Drugs is definitely a way that you can change your state of consciousness, right? Your awareness. Some of you may or may not have seen this live or in person or have experienced it yourself. How does this happen? Let's talk first about the principal abused drugs. One of the drugs that tends to be abused is narcotics. Generally, narcotics, right? For those of you who have had, say, for example, a car accident or surgery, things that are generally pain-producing, these drugs are derived from opium, and they have the ability to relieve pain. Now, when we are taking a narcotic and we are abusing, specifically when we are abusing a narcotic, we can start dealing with the desire. What we are looking for is perhaps euphoria. We're trying to relax. We're trying to reduce that anxiety. And of course, its primary effect, or let's call it identified effect, is pain relief. Right. So that's one of the reasons why persons engage in abuse of narcotics. Now, I used to work mental health at a clinic, which main purpose was pain reduction, right? So they did prescribe a narcotics, but they had a really good mental health program because they saw that there is a significant element between pain and mental health, right? So even our pain perception has to do with your mental health. So if I, give you a good left hook, I've been told I have a good left hook. I don't know. I've been told that. But if I punch someone, that person may rate that pain as maybe a 6, and then the next person's like, well, I didn't feel that. It was like a 1, right? Our own mental state will have an impact as to how we perceive pain. So part of the therapy that we used to do at that center, first of all, was psychoeducation, educating people about pain, educating people about their medication, but also how to tolerate pain. That was I really enjoyed working there. Their mental health program was pretty neat, how they mixed the medical with mental health. We also have other drugs that are abused. For example, we have sedatives. I think we might have talked about that a little bit before, but a sedative is basically trying to alter your sense of awareness because it induces sleep. Right? It induces sleep. So sleep aid medication, trazodone, right? Some antidepressants may have this same effect. And how do they work exactly? Well, their purpose, right? Their primary identified effect, right, is that they're trying to decrease, right, that activation, right, of the central nervous system, right? They're trying to shut down that central nervous system. And hence, they're going to start shutting down your behavioral activity, which is why when you are under a sedative, it's not recommended that you drive or operate certain instruments because your central nervous system is shutting down. Now, people who are abusing this type of drug, what is their desire, right? What is their desire? Generally, euphoria, relaxation, and also reduce inhibitions. I'm trying to be more brave or less shy, right? So that's another desired effect that some individuals may be seeking when abusing sedatives. What I've seen mostly in practice is the relaxation part, the anxiety. I have way too much anxiety, let me take the sedative. When in reality, that wasn't the identified purpose of that medication. The identified purpose of that medication was to help you sleep, not to help you relax, right? So that can lead to abuse for sure. Conversely, we have stimulants. So if you go back to your slides towards the right of your presentation, we have stimulants. A lot of us, a lot of people in the college environment, including faculty, all right? So I'm not exempt. I can tell you, I don't know how I would have survived college and graduate school should have not been by stimulants because I love me some caffeine, right? And caffeine is a form of stimulants, right? Stimulants, contrary to my sedatives, right? Contrary to my sedatives, what they're trying to do is to increase, right? Notice that here with the sedatives, I'm trying to decrease, but with the stimulants, I'm trying to increase, right? I am trying to increase that activation, right? Nicotine is a stimulant, right? Caffeine is a stimulant. So you'll notice that the intent is to activate your nervous system, your central nervous system. What am I looking for, right? What are the desired effects? Feeling elated, feeling excited, right? Having increased energy, reduction of fatigue. Now, there is especially here in a college environment, the abuse of stimulants tends to be a little bit more frequent, right? First of all, this is a high pace, high demand aspect that you're dealing with now in college or later in graduate school. So this is a high pace, high demand, right? There's an expectation that you're going to attend class, an expectation that you're going to complete your research projects, expectations from society that you're going to graduate, your grants, financial aid, scholarships, faculty. You have a lot of expectations on top of your family, friends, maybe your first generation college. Right? Maybe you travel from a whole different country, right? You left everything behind just so that you can succeed here, right? So there's a lot of expectations. So we can see a lot of abuse of stimulants here, right? So people taking ADHD medications that may or may have not been prescribed to them, right? In order to become stimulated and be able to concentrate and do the certain, right, study until 4 in the morning, right? So notice that it is pretty common with an age group, right? That's not to say that it doesn't happen with other age groups, but bless you. But when it comes to age groups, remember, when you become a therapist yourself, notice that age also has a role on the presenting issues that your clients may have. It will be more common to see a population of students abusing stimulants than, say, another age group. Right? And I refer by college age, I'm referring to like 17 to 25, but that general, which most of you fit in that traditional age group. So any questions about abuse, drugs, and their effects? What about my folks online? All right. So that is going to bring us to the end of the lecture, and I'll see you next week.